Okay, this is part 3 of our endocrine system tour. This part we're going to be looking at how the body uses hormones primarily for maintaining homeostasis and for a few other purposes as well, but primarily this will be our main focus. So, generally speaking, let me get our, sorry, I forgot to, okay. All right. If we have a specific body condition, whatever that may be, that is getting too high, all right, imagine some situation, maybe you have too much of a particular chemical in your blood or something. That situation would stimulate some gland, okay, which would then secrete some hormone, which would then act to lower the body condition. But what if the body condition that is of concern gets too low? We lower it too well. We don't want that to happen either. That's not homeostasis. We want to keep it in the middle. So another gland would be stimulated at that point to release a second hormone, some different hormone, who, guess what, would act to raise that body condition back up. So essentially what you have is this kind of double loop system where you're going to raise the body condition, but if it gets too high, we're going to lower it, and we're just going to constantly be monitoring. It really acts just like a thermostat in your house. If your house gets, you set your thermostat for a level. If it gets too hot, we're going to turn on the air. The air conditioning will come on. If it gets too cold, the heat will come on. So, this is called negative feedback. That's not a bad term for you to highlight for yourself. Negative feedback. We're going to see something, it's going to get too high, whoops, we're going to bring it back down. We're going to see something that's going to get too low, whoops, we're going to bring it back down, or bring it back up, if you will. So it's a negative feedback. If we're getting messages, we're going to make corrections, and we're going to bring back and keep things at a level, a homeostatic level. Now, body temperature, controlled more by the nervous system really, but it's a great example that works really similarly, okay? Suppose your body temperature gets too high. We are used to thinking in terms of Fahrenheit, 98.6, well, 37 degrees Celsius is the more scientific way to think of it, but in either way, cells in your hypothalamus, which is really part of your brain, it is the master control of your endocrine system really, but that's not our main focus here. We do have sensors in our hypothalamus, which is a part of your actual brain, not necessarily a gland of any kind. It's nervous tissue. Will stimulate nerve signals to cause you to sweat. Okay, sweat because of evaporative cooling. If you'll remember from when we talked about water at the beginning of the year, evaporative cooling, and also dilation of blood surface, the surface blood vessels in your skin. We're going to make those get wider and allow more blood flow to go to your skin in an effort to get rid of more heat. So here you go, great little diagram of sweating and then increasing the size of the blood vessels to get more blood to the surface of the skin so that heat can be given off and not be contained in with your body organs. Now, suppose you do this too well. You sweat too well. You get your blood vessels dilated so well that you start to get a little too cool. So if our body temperature gets too low, too far below 37 degrees Celsius, then again, cells in your brain, your hypothalamus, will send other nerve signals to other parts of your body, your muscles, and cause you to shiver. That shivering acts to bring up your body temperature due to the kinetic motion that you're experiencing, and also acting to constrict surface blood vessels so that we keep too much heat from getting to your skin surface, and we retain that heat in the body core, in the core of your body. So this is going to have a couple of different activities to bring that body temperature up and make it high. But what if it's too high? Well, we're going to enter this top loop again. Okay? Now that's nervous system. This is endocrine system, but watch, it really is quite similar. And this is one you ought to know. I don't know how many different ways to say that. You need to know the blood sugar endocrine system hormones and what they do. Okay? If your blood sugar level, your glucose level in your body gets high, your pancreas is the organ that is going to be doing something about that. We think of the pancreas as a digestive organ, secreting digestive enzymes into the first part of the small intestine, the duodenum, which it does, but it also is an endocrine organ that secretes insulin into the bloodstream, not into the digestive tract, but just into the bloodstream. Now, insulin, if your blood sugar level is too high, insulin will be created by your pancreas and secreted into your bloodstream. And in particular, the parts of the pancreas that are doing that are these little regions of cells called islets of Langerhans. Okay? And basically what this hormone does is it encourages your body cells to take up sugar from your blood, to take it up and out of the blood and get it put away into cells where it can be used. Primarily, we are talking about the liver, because if you'll recall from a little bit earlier, the liver is where glycogen is stored in animals, so that if you need it for something, you can break it down and get to it. You can get that sugar if you need it. So we're going to store this sugar that is racing around in your bloodstream and you're not able to use it fast enough. You're going to store it in your liver, and the insulin hormone is what allows that to happen. Now, what if we store it too efficiently in our liver? We're storing so much in our liver that actually our blood glucose level is going to get low. Maybe a little too low. So our thermostat is going to kick in a different way. Same organ, the pancreas, okay, is going to release a different hormone. This hormone is called glucagon. What's it called? Glucagon, okay? That's the less famous one, okay? This is also made in the islets of Langerhans, but if you'll notice, it's the alpha cells in the islets of Langerhans, whereas it was the beta cells that up here that made the insulin. So the same group of cells, slightly different cells in these groups do different things. Glucagon, guess what, is going to encourage the liver to release glucose, okay? So we're going to encourage the liver to release glucose as we need it to keep our blood sugar level where it should be. And also, obviously, you'll notice there, it would make you hungry as well. Okay. Just get the overall picture of this loop. Understand where these hormones come from. They both come from the pancreas, different cells in the pancreas. Understand what insulin's job is. It is to get that blood sugar out of your blood and into the liver where it can be stored and later used as you need it. And glucagon is what's going to release that glucose from the liver as you need it. And we're going to try to keep the blood sugar level right in the level where it is needed. We don't want it too high. We don't want it too low. Okay? Negative feedback. Okay? This is a really, really important slide. This is a great example. It's not a difficult one, and it's something that's really relevant. Lots of people are diabetic, and this is what's wrong. Either they don't make insulin, so their liver cannot take up the glycogen, and they can't get this sugar that they are going to need in a useful way because it's just racing around their blood and it's eliminated in the urine. It may be that they make insulin, but their cells don't have the receptors to use the insulin properly over here. I was pointing the wrong area. So lots of different things can lead to diabetes, but it's all dealing with this insulin relationship. Okay. All right, I think I will stop that and upload this chunk, and then we will move on to the next part. Thanks.